movements of the acromioclavicular joint. If we see the movements of the acromioclavicular joint, as we discussed earlier, this acromioclavicular joint is a 3 degree of freedom. 3 degree of freedom is total 6 movements will be there. The first means 6 movements will be there. Those movements are upward rotation and downward rotation. Upward rotation and downward rotation, and internal rotation and external rotation. So here we will be having anterior tilt and posterior tilt. Anterior tilt and posterior tilt. So these are the 6 movements are present in the acromioclavicular joint. We'll see one by one. First one, upward rotation and downward rotation. First one, upward rotation and downward rotation. To understand this, suppose imagine here we have the thoracic spine. Here we have the scapula. Here we have the scapula, and then this is the acromion process. This is the inferior angle of the scapula. Suppose if the upward rotation is happening, upward rotation, how it will happen? The scapula will move in this direction. So that the inferior angle of the scapula will move away from the body. Suppose if downward rotation is happening, the inferior angle will move towards the body. So this is the movement, upward rotation and downward rotation. This movement is going to happen in the frontal plane. Frontal plane means what is the axis? Sagittal axis. So this is about the upward rotation and downward rotation. Now we will see internal rotation and external rotation. If you see internal rotation and external rotation, these two movements are going to happen in the horizontal plane, nothing but the transverse plane, so that the axis will be vertical axis, also called as the longitudinal axis. Suppose now you take mean, we have to understand this internal rotation and external rotation, we should take the scapula line. So this is our scapula. So this is the glenoid cavity. Here this is our midline of the body, otherwise thoracic spine. So here we will be getting head of the humerus. This is posterior view. So to understand this internal rotation and external rotation, when the scapula here acromioclavicular, when it is going to internal rotation, the glenoid cavity which is present here, it will move anteriorly. So that the scapula which is present here, it will move like this. It is going to move like this. Here it is not like rotation. Rotation will be like this. This is rotation. This is upward rotation, downward rotation. But here internal rotation is only scapula. It is going to like protraction. It is going to move like this. So that is the internal rotation. And external rotation opposite. If it is moving like this, so the glenoid cavity will come towards the body. That is external rotation. And internal rotation means the glenoid cavity will move away from the body. And one more name is there here. This internal rotation also called as the medial rotation. External rotation also called as the lateral rotation. These rotations are going to happen in the transverse plane, vertical axis. When internal rotation is happening, the glenoid fossa which is present here, it is going to move anteriorly. See, it is going to move anteriorly plus medially. When external rotation is happening, the glenoid fossa which is present here, it is going to move posteriorly plus laterally, and anterior plus medially in the internal rotation. This is about the rotations of the acromioclavicular joint. Last one movement is there, that is the tilting, anterior tilting and posterior tilting of the scapula. See here, anterior tilting and posterior tilting, These movements are going to happen in the sagittal plane. Sagittal plane means what is the axis? Frontal axis. These movements are going to happen in the sagittal plane. For the sagittal plane movements, axis will be frontal axis. Now if we see, this is our thoracic spine. Here we will be having this is the scapula. This is the spine of the scapula. This is our scapula. This is superior angle, inferior angle, acromion process of the scapula. Now we will see what is this anterior tilting. To understand this, here I am drawing. See, this is our clavicle. Okay, clavicle. This is the point where AC joint will be present. This is the clavicle. So first one we will see anterior tilting. When we are observing this, we have to focus on the superior angle of the scapula. In this movement, especially in this tilting movement, here clavicle will be stable. And when the anterior tilt is happening, the superior angle is going to move upward or anterior. It is going to move anterior. So that scapula is going to move anterior. Here clavicle is stable. It is going to move anterior. This is anterior tilting. Posterior tilting means the superior angle will move downward, otherwise posterior and inferior. Here anterior plus superior in anterior tilt. Posterior tilt means posterior plus inferior. It is going to move like this. So here the point we have to focus on the superior angle of the scapula. So this is about the movements of the acromioclavicular joint. Here one last point I tell, then we will finish it. First movement, upward rotation or downward rotation. Second movement, internal rotation or external rotation. This internal rotation also called as the medial rotation. External rotation also called as the acromial rotation, lateral rotation. Now we will see anterior tilt and posterior tilt. Okay, here when we are observing this, In upward rotation and downward rotation, we have to focus on the inferior angle. So inferior angle we have to focus how it is moving. When we are seeing medial lateral rotations, here we have to focus on the glenoid fossa, how the glenoid fossa is moving. When we are seeing the anterior and posterior tilt, we have to see the superior angle of the scapula. So this is the movements of the acromioclavicular joint. Clear?